Hello, very good evening to everyone. Today, myself, Dr. Sudhir Mukherjee, an interventional cardiologist, will be discussing about next generation once daily formulation of Trimetazidine and in the management of angina. So, bridging the gap in angina management. So, to start with, I would like to present you an interesting case where a 62-year-old man with hypertension and diabetes presented with chest pain and shortness of breath. He is 62 years old and he is hypertensive for 10 years and type 2 diabetic for 8 years. Current treatment includes pedintrapil 4 mg per day, amlodipine 5 mg per day, atorvastatin 10 mg per day, linagliptin 5 mg per day, and metformin 500 mg twice daily. In physical examinations, the weight is 78.8 kg, height 172 cm, BMI 27 kg per meter square, blood pressure 146 by 92, heart rate 68 beats per minute, and in the cardiovascular examination there is a mild cardiomegaly, and in ophthalmologic examination it was found that grade 1 diabetic retinopathy. So the investigations were done and it revealed that CBC, sodium potassium urea, creatinine, LFT and TFT were normal. Fasting blood glucose of 140 mg per dl, plasma postprandial glucose level of 180 mg per dl, HbA1c of 7.2%, total cholesterol 212 mg per dl, with LDL cholesterol level 120 mg per dl, HDL cholesterol 34, and triglyceride 230. ECG revealed left ventricular hypertrophy with mild non-specific ST depression, and echocardiogram was advised, which revealed LVH with grade 1 LV diastolic dysfunction. Chest X-ray showed mild cardiomegaly. TMT was advised, which revealed positive. So the diagnosis of chronic coronary syndrome (CCS) grade 2 effort angina was made, and based on the reports, the treatment modifications was done, which is quite understandable. We had a bisoprolol of 5 mg per day to control the unregulated blood pressure. Atorvastatin was increased to 40 mg per day as the LDL levels were high. Metformin was increased to 1000 mg twice daily because the fasting plasma glucose and postprandial plasma glucose was high. Nicorandil 5 mg twice daily was added because the patient complained of chest pain, and it was referred to a dietitian for further dietary and lifestyle modifications. So after 6 weeks follow-up, it was found that the CCS grade 2 effort angina, where the treatment adjustment was done, the patient blood pressure and sugar within normal range, lipid profile improving, but patient was apprehensive of angina. Therefore, coronary angiogram was advised, and it revealed only 30% luminal stenosis of mid LED, left and right descending artery. So the question comes, what to do next? Because of the 30% block in the LED, which definitely is not a candidate for angioplasty. At the same time, patient is also experiencing chest pain, angina. So angina remains a therapeutic problem in spite of current treatment option. He has been receiving the beta blockers, SC inhibitors, and other anti-diabetic and anti-hypertensive therapy. So to quote, there was one study which is called Clarify study, and why it is important? Because it showed that the 50% of the angina patients remain symptomatic in spite of standard therapy. And they considered a baseline level of angina which included almost 7,000 patients, and at 1 year, persistence of angina was 3660 and resolution of angina was 2858 patients. They are followed up for CV death and MI primary outcome and revealed that 7.6% of patients who had a persistence of angina at the hazard rates of 1.32, they developed cardiovascular death, including MI, fatal or non-fatal, with a statistically significant value. And those who had a resolution of angina, 5.9% of them had these incidents. Therefore, those patients who are having angina has a higher incidence and prevalence of happening this kind of cardiovascular disease, mortality and morbidity overall. And that's where the importance of treating angina is. So 2019 CCS guideline says that the main goals of pharmacological management is improvement of prognosis and angina relief. The aims of pharmacological management of CCS patients are to reduce the angina symptoms and exercise-induced ischemia and to prevent cardiovascular events. Available drugs, the anti-ischemic drugs which have proved benefits regarding symptoms associated with myocardial ischemia, but do not prevent cardiovascular events in most patients with CCS. So current angina, anti-angina treatment have no data on improvement of prognosis in chronic angina patients. So the optimization of medical therapy needs to be done in this patient that we are talking about. So what to do? So at this point, it was decided that the trimetazidine to the patient's treatment regimen to be added. And as you know, the 2019 ESC guidelines for the diagnosis and the management of chronic coronary syndrome, the task force for the diagnosis and management of chronic coronary syndrome or idiopathic society of cardiology has upgraded the trimetazidine from class 2B to 2A. And who are those ideal patients for trimetazidine? The diabetes patients with diffuse vessel disease and reduced LPA, post-PCI CAT patients who continue to have chest pain or symptomatic angina, patients with LV dysfunction and RHD, patients with multivessel disease not willing to undergo CABG or intervention, patients with inducible ischemia but no angina due to large perfusion defect, patients suffering from ACH with severely stenosed vessel where angiography is not possible. So these are the factors where trimetazidine is found to be useful. It was decided to start with the patients with trimetazidine OD, 80 mg once daily, unique, globally approved once daily formulation, which is now also available in India. And this indicated for all symptomatic angina patients. Only 80 mg once daily formulation approved by DGCA, Drug Controller General of India. And the innovative MLMT technology is there, which has been used in this once daily formulation. It's a multi-layer microgranular technology for uniform release of trimetazidine to ensure full 24 hours coverage. And the granules are made up of inert core granules coated with drug layer, trimetazidine, and covered with a coating layer. So, granules are enclosed in a capsule that contains a total daily dose of 80 mg. Once in the stomach, the capsule dissolves and the coated granules are sprayed to the GI tract. And it is getting this micropores in the coating layers enable the controlled release of trimetazidine for full 24 hours. So, we do also have the real world evidence with trimetazidine 80 mg once daily that has been published in several journals, which clearly tells that the effectiveness of long-acting trimetazidine in different clinical situations in patients with stable angina pectoris, the findings from ODA trial, the anti-anginal effectiveness and tolerability of trimetazidine modified release 80 mg once daily in stable angina patients in real-world practice. Effectiveness of this once daily has also been found in multi-center prospective observational study, one-cup study. So, all this study, the ODA trial and the one-cup study, has established the role of once daily formulation of trimetazidine, which is very effective in controlling the symptoms of angina. Coming to ODA study design, this was an observational multi-center prospective Russian study in a real-world clinical setting. Trimetazidine 80 mg once daily for 3 months on top of hemodynamic treatment was added. The patients included about 3,066 with coronary artery disease and stable angina with persistent symptoms despite therapy. Angina attack frequency, short-acting nitrate consumption, CCS angina class, overall efficacy and tolerability all were taken into the consideration. And when it was analyzed for 4 weeks, as early as 4 weeks, it revealed that the mean number of angina attacks per week has decreased from 52% in 1 month and 81% in 3 months. Also, the number of short-acting nitrate used for the angina symptom has been reduced from baseline to 1 month, 56% and 84% in 3 months. So this non-interventional multi-center prospective study showed that the effectiveness of trimetazidine over a very short period of time, and that has also sustained over a long period. So more patients are angina-free with improved exercise efficacy with the use of trimetazidine 80 mg once daily, and it has clearly shown that at month 3, almost 92% of the patients were free of angina. So that was a clearly definitive data. These symptoms were assessed by patient questionnaire regarding physical activity improvement that results from patient declaration for no limitation to moderate limitation. It has also increased the compliance and the higher satisfaction for the patients. Patients are more compliant with once daily dose. At month 3, it was 56%, assessed by patient questionnaire from again, result from patient declaration, and they are more satisfied. And in the scale, it was found to be 9.5 out of 10, where 1 is not satisfied and 10 was very satisfied. So, The ODS analysis, which was done later on, or switching to Trimetazidine 80 mg OD, that also revealed the same kind of thing. The study design was that the patients were divided into two groups. One was Trimetazidine naive patients, another was previously treated with Trimetazidine 20 mg thrice daily or 30 mg twice daily. Both groups received this 80 mg OD for 3 months on top of hemodynamic treatment, and angina attack frequency, short-acting nitrate consumption, functional status, overall efficacy were analyzed, and it was found that Trimetazidine OD 80 mg decreases the frequency of angina attacks and decreases the consumption of short-acting nitrates in as early as 4 weeks. And this reduction in the initiation group came from baseline value to at 1 month by lower 50%, and at 3 months it was further lower by 81% in cases of this angina-free symptom compared to Trimetazidine. So more than 90% of the physicians are satisfied with the overall effectiveness of Trimetazidine 80 mg once daily dose, and 3-month non-interventional multi-center prospective study of stable angina patients in these subpopulations clearly established the role of Trimetazidine once daily. So coming back to the cases to which we have started and what to do. To optimize medical therapy, further management Trimetazidine 80 mg once daily added to the current treatment. Outcome after 2 months, the patients become angina-free, risk factors under control, medicines continued with advice for weight loss, and patient also reported a decrease in the consumption of short-acting nitrate. An improvement in exercise capacity has restarted brisk walking during the evening. So to conclude, angina remains a therapeutic problem in spite of current therapeutic options. Trimetazidine 80 mg once daily is the only globally approved formulation and is also the only DDCI approved once daily combination. Real-world evidences have confirmed the benefits of Trimetazidine 80 mg once daily in routine clinical practice. Improvement in exercise capacity as early as 4 weeks, significant reduction in angina attacks as early as 4 weeks, and better patient compliance and high patient physical satisfaction were found. Therefore, whenever we are getting these angina patients who are suffering from chronic stable angina, a chronic coronary syndrome, nowadays we call it, the Trimetazidine 80 mg once daily formulation should be applied to relieve the angina symptom and to get benefit of this beautiful drug. With this, I conclude this session, and thank you very much for listening.